Dr. Russ Rosen here. Hope you're loving life. I'm out here in Maui in a little hut, and I'm going to check and see whether or not this is going live. Let's go ahead and see, because as you may know, if you've been watching lately, it has not gone live, and I've just talked to myself. So we're going to go ahead and make sure that we're live. Good. We are. What a concept. Zuck, my brother, you got it happening. I appreciate it. All right. So, welcome to the master class on communications. We're here 3 Tuesdays per month at 1:30 California time or Pacific time. If you don't know, I help natural health care providers like you thrive in a care versus care, true optimal health model, so your patients get what you do, want what you offer, and happily stay, pay, and refer for a lifetime. If you find value, you can please share this with other practitioners. Oh man, I got mosquitoes. My legs are on fire right now. We just had big rain and big winds, and man, the mosquitoes are going off. And also, if you want to dive deeper into this subject, just put club below. I'll give you a link to the club where you can get a free month and just dive much deeper into these subjects where we have conversations. We get in Zoom and we have an hour conversation helping it become real for you, customize it for you, answering all your questions, etc. Okay, if you are here live, please go ahead and put your name and where you're from. Say aloha to me. And if you have any questions as we go, let me know. When I'm done going through this information, I'll go ahead and check and answer any. So what I know to be true is that most of us really want to help our patients get healthy and stay healthy and have the best life possible. And we really want them to understand the value of our care so they happily stay, pay, and refer for a lifetime. Many of us get very frustrated because we have such a great gift to give. We have so much to offer. We can help people in so many ways, but our patients just don't get it. You know, they see us as neck pain, back pain, headaches, whatever it is, but they don't see the long-term value of what we can do for people. They just don't value it. So we need to learn to communicate in a different way, in a care versus scare, true optimal health model. We're not going to use scare tactics like subluxation, this silent killer, and I understand it, I get it, but we're not going to try and scare people or manipulate people. We're going to instead empower them to make reasonable and logical decisions by giving love and choices and truth and consequences. So we're going to inform, we're going to make sure they understand it. This is the big part, because for most of us, they don't. We just lecture them and they drool and fall asleep. And we're going to make sure that we're not manipulating using fear or using scare tactics. So in the optimal health model, we play our role in their healthcare. We recognize that we're not everything to everyone. We have a specialty, right? You may think meditation or prayer is a good thing, but it doesn't mean you teach it for everyone. So we're part of their healthcare team. So the question is, what is it that you can offer your patients? Well, last week we went into great detail about this. So can you help them feel better? For most of us, the answer is yes. Could they prevent problems in the future? For most of us, the answer is yes. Could we help them be healthier in 5 years than they are right now? Again, for most of us, the answer is yes. If they were under regular care with you and did what you recommended, would they end up having a better quality of life? Again, for most of us, the answer is true. It may or may not be for you, but you need to clarify the truth about what it is that you do. So remember last time we got clear about what it is that I do. I help people get healthy, stay healthy, and have the best life possible. And here's how I accomplish it. I use these specific chiropractic techniques to cause these things, this nutrition for these reasons, this, these therapies for this reason, this type of neuroemotional work for this reason, this lifestyle advice for this reason, etc. etc. Oops, etc. So, one of the tools we use to communicate with our patients is the path to optimal health, where we look at -10 is near death and 0 is comfort. We feel good, but we're not functioning at our optimum. And then there's optimal health, we're as healthy as we could possibly be. So we talk with our patients. We, during the communications visit 1, visit 2 process, we're planting seeds for this. So by the time we get to the report of findings, they really understand the difference between feeling better and functioning better, between just feeling better and masking their symptoms versus them resolving their problems and actually getting healthy. So there's more to it than that. We go into a lot of that in the club. And if you would like this, just go ahead and put club below. I'll let you in there, and you can download a copy and use as many as you like forever. So what we're going to do is we're going to find out what our patients want in relationship to what we can truly do for them. I was at a seminar with someone that I really like a lot, so I won't use their name because I don't want to, it would sound disparaging, because I really like this guy a lot. But what he said at the seminar was find out what they want and show them how to have it. They want to get their neck cracked, crack their neck, and they'll become a crack addict. That was his little wrap on that. And I disagree. I think we want to find out what they want in relationship to what we can truly do for them. For most of us, we can do so much more for them than they thought. Prevent problems, be healthier in 5 years, have a better quality of life, resolve issues. They never thought about that with us. All they ever thought about was getting to here, to 0, to feeling comfortable. So we're going to find out what they want in relationship to what we can truly do for them. Then we're just going to show them how to have it. So what if they want something other than optimal health? Is it okay to give it to them? What if they say, I understand that, I really do, I appreciate what you're saying, I just want to get feeling better? Well, it's up to you. You could do that for them, recognizing you now have time to build a relationship and help them see more that you can do for them. You can say, that's not what I do, and refer them out. You can let them, okay, we can take that in stages, whatever it is that you want to do. But we have to have a tool to be able to have these kinds of discussions. Now, again, in the club, we're going into extreme detail about this and how to use it. So a challenge that oftentimes comes up is people will say to me, and they'll usually whisper in our one-on-one coaching, they'll say, I now have patients telling me they want to get healthy and stay healthy. And the truth of the matter is, I just don't know if I can deliver that. I've really been in a pain-based model for so long. I just don't know that I can deliver it. If that's true for you, then that's a contradiction you need to work through. It's something I'm really good at helping doctors work through. And if that's something going on with you, you can just let me know, and maybe we can get on Zoom and talk that down. Okay, so we need to clarify exactly what it is that you do. Again, we went through that in detail last time, how people get healthy and stay healthy, best life possible. Here's how I go about doing that. Once you're clear about what it is that you do, we need to learn how to communicate it. We need to simplify our message to make it simple and easy for an average human being to understand. Again, we'll be going through great detail in the club about that, but you need to make sure that your message is clear and simple. Clear and simple. A couple of sentences, maybe a paragraph on more the detailed work that you do. You can do a whole talk on the subject, but you need to be able to communicate it in a simple way. Now, what we're going to be diving into in the club in great detail is the neuroscience of communications. It's a science. It's the science of getting people to say yes, who want to say yes. The reality is, you can cause people to say no who wanted to say yes. You do it all the time. Have you ever seen a patient that came in, they seemed to be with you, and all of a sudden their eyes glazed over and they started drooling? Have you ever had a patient that seemed to be with you and said, I got to go home and think about it? You caused it. And when you understand the neuroscience of communications, you can quit causing it. My favorite book on this subject is Influence, The Psychology of Persuasion by Robert Cialdini. It's one of my favorite books of all time. And one of the things is he shows you a concept and then he does studies. He's at a major university and he takes 3,000 people and does this. 3,000 people and does this, and he sees which one gets a better result. One of the studies they did was they had a wait staff repeat the same words back to the patron or slightly different, and they watched what happened. So a a a person at a restaurant would say, "I'd like a ham on rye, hold the mayo." Now, if the person responded, "You'd like a ham on rye, hold the mayo," versus, "I would like a ham on rye, oh, you'd like a ham on rye without mayo," if they said the same words back, they got 23% better tip. So if they said, "You'd like a ham on rye with no mayo," they lost 23% of their tip. How come? Because they didn't use the same words. And that causes something subconsciously. Clearly, the patron did not say, "Oh, you didn't use my same words, I'm going to give you 23% less of a tip." They just didn't feel engaged. They didn't feel connected. There's so many of these little things that once you understand these, you can have a completely different experience. You literally can turn people away. And again, I promise you, you do it all the time. We'll be diving into extreme detail about this in the club. So just a quick hit on the neuroscience of communications. We've got a reptilian brain, which is doing filtering, and it's all about survival. The truth is, in an average conversation, we hear about 25% of what the other person is saying. What percentage of your information would you like your patients to understand? 100%, of course. Problem is that our reptilian brain is filtering information out, so it never makes it to the neocortex for thinking, reasoning, and problem solving. If it does make it there and it makes sense, and what we do makes sense, it'll drop into the limbic system, which is the belief systems, the emotional system, where all buying decisions are made. So our job is to get our information past the reptilian brain and the neocortex for what? Thinking, reasoning, and problem solving, to drop into the limbic system, the new belief system. And again, in the club, we'll be spending an hour where we'll be discussing this, and I'll be going into extreme detail of exactly how to do this. It won't be a teaser. I'll go into exactly how to do it. So if you would like to join our call, it's this Thursday, 11 o'clock California time. If you cannot make it, that's okay. We post it in the club so you can review it. I will also be posting this for free if you want to get it. I'm going to go ahead and check. We got Roxanne Schmidt. Aloha, Doc. Good to see you. Most likely I'll see you in the club also. If you have any other questions, now would be the time to ask. And there's about a 10-second delay. So I'll wait about 10 seconds while I scratch my leg, because the mosquitoes have won here. I am losing. Okay, well, no other questions. I hope you found value in this. I hope to see you in the club. If you know other folks you think might find value, please let me know. As always, much love and aloha. Bye, gang.